All right, good morning, everyone. Thank you for joining us today on The Jungle. I am Whitney Mendoza, coming to you live from our studio in the Sandy Springs, Georgia area. And this morning I have Dr. Jessica Steier.
Close enough.
Steier. See, I knew as soon as I practiced it 3 times before we went live, and then we were going to go live. Steier. See, well, thanks for being such a good sport about my mispronunciation of your name, even though I practice it so many times. So she is co-founder and CEO of Vital Statistics Consulting, and I'm really excited to have you with me this morning because one of the things that we're going to dive to is, and I'm going to quote you because I think you used the hashtag COVID burnout.
Oh yeah.
I think we're all maybe beyond that at this point. But kind of to allude to what we were talking about earlier is that there are new things developing every day. So I definitely want to hit on those and kind of, what's happening today, if only today. I think that's kind of how we're getting through this, right? We're taking it one day at a time and adapting as such.
That's all we could do. Yes, our new reality.
Yeah. Mm-hmm. So Vital Statistics Consulting, tell me about how that came about. Why did you know this was needed in the world? Tell us your journey.
So it's actually a funny story. So I co-founded Vital Statistics Consulting, VSC, with my partner, Dr. Bill Gallo, who was my professor in my doctoral program at CUNY. And we kept in touch after I defended my dissertation. I graduated, and I just always had the utmost respect for him, this brilliant guy. I was working at a health policy firm outside of DC, doing really incredible, exciting work. I kept in touch with Dr. Gallo. It took me a really long time to call him Bill. And I said, you know what? You've got the brains, it's amazing that you're in academia and, doing incredible things, shaping the minds of the future. But I feel like, you have this really unique skill set, and together we could do something really great. So he's really the statistical genius. I'm more on the operational side of things, project management, keeping us on task, big picture type stuff. And so we just kept the conversation going. It started really small. We were working with Doctor of Nursing students and helping them with the statistical pieces of their dissertations. And then it grew. We realized we do have a unique skill set. Healthcare is obviously a very important topic. Let's do something bigger with this. Yeah. And so the company really evolved over time and grew, and we went from working with individual nursing students to healthcare systems, state governments, healthcare organizations. So it's really cool stuff.
Yeah, awesome. So so I am in our studio this morning in our office space. Where are you this morning?
I'm in Jupiter, Florida.
Nice. Okay. And are you at home?
I'm at home. Yes.
Awesome.
You'll probably see my naked toddlers in the background at some point.
That's the only reason why you won't see my dog, because otherwise she knows when the camera's on. And so that's her time to wake up from her nap and try to come get on camera. I say all that to say, so we're currently in this, we're still, which everyone, another word everyone hates by this point is social distancing. But we are practicing that in our office. We're kind of taking shifts, certain people are coming in on certain days. And I want to read this a little bit just to get it right. But back in May, you did this conference that was this virtual summit that was COVID-19, translating the science and exploring the path ahead. And it was kind of centered around, correct me if I'm wrong, employee testing, data analysis, and going through the safety measures and precautions of being able to go back into the office.
Kind of. So we're kind of combining a few different things. So, so the really cool thing about our team is that we're really interdisciplinary. So my background's in public health. My partner's a health economist. We have immunologists, clinicians. I mean, you name it, we have it on our team. And so we said, COVID is, it's you can't just have a clinician perspective or a scientist, but you really need to understand all different perspectives. So we came together and we said, let's do this summit covering all different types of topics, ranging from the immunology of COVID, the transmission, the history of it, how it came to be, to, okay, how is it affecting population health, and how is it affecting different segments of the population differently? And then taking it even a step further and saying, okay, so now we're in this. How do you deal with this as a parent or just as a human?
Yeah.
And so we put together this summit that was just lots of different approaches to COVID, lots of different topics related to COVID. And just one other thing I'll note, and I'm sure we'll talk about this later, but the other things you were talking about, testing, workplace safety, we pivoted our business, and those are other service offerings not related to the summit.
Okay. So let's stay on the summit because COVID, our shelter in place orders and things like that. Again, I mentioned we were in Georgia. Everything, if my brain serves me correctly, because it feels like we went through a whole year in 3 months. Mm-hmm. It started in March, right? March was really when everything started shutting down and we were having to shelter in place. And you did the summit in May. And that was a really short time span to kind of pull all these resources together, pull the topics together and say, okay, we need to get this information out there. So I'm curious as to how exactly you pulled that off, because we, as a marketing company, know it kind of takes some time. Like typically you have months to plan for this sort of thing, if not longer.
That's a really good question. I'm not quite sure how we pulled it off, to be honest with you. And we spoke to a lot of specialists in the field, because we're scientists. We're not marketing people, not communication specialists, nothing like that. They basically told us, you're trying to pull off the impossible. But I don't know. We did it. I think, I've sort of been living and breathing COVID. It's kind of like my third child right now. Fourth, not my husband. But, I just feel like we're all drinking from a what is the expression, from a fire hydrant or a hose, whatever it is. And so much information being hurled at us. So I've just been monitoring everything constantly. I know my team has been doing the same. And I'm lucky to have an amazing team. I'll thank them, honestly, for being able to swing the logistics of it.
Yeah, that's amazing.
Sorry, I didn't really answer your question.
No, I mean, you did essentially, because I feel like that's really, it's kind of been this overarching theme of all of us kind of experiencing this together, is we've just been more gracious with one another, right? Like we understand that everyone's trying to collect. We all want the information, and those who have it are trying to collect it and provide it in the most concise and up-to-date way. And as you mentioned, like we've got kids running in the background and dog and cat tails that kind of, come across the screen. And so it does take a team. It does take a village to kind of pull all this together, which pulls me to where your business has pivoted since COVID, in the sense of everyone transitioning back to offices or even schools, right? Like here in Georgia, I know most of the schools there, if they haven't declared that the whole entire 2020, 2021 school year is going to be virtually, we know for a fact that the first half of the school year is. So tell us kind of what you're doing and what the future holds as of today.
So typically pre-COVID, we were really a data analytics firm. And I say that doesn't really capture everything we do, but we were really the ones crunching the numbers, designing evaluations, crunching numbers. And we've really pivoted in the time of COVID. As I said, there's all this information being hurled at us. And the interesting thing for me about science is that, the manuscripts that are put out are really not intended for public consumption. Right? Mm-hmm. They're really intended for the scientific community. And then you throw in social media. So now we're posting these studies, and people who really aren't trained to understand, how to critically appraise the research, they're taking little snippets from the articles and they're kind of misinterpreting, misapplying. So we felt we should pivot our business. Instead of simply doing the data analytics, now we're really focused on scientific literacy and the translation of the science. So we we just launched a newsletter, this weekly newsletter, where we break down scientific articles in a way that's understandable for the general public. We are actually launching our very own podcast, which is going to be translating the science. And something else we're doing is, we're realizing, to your point, we all want to safely reopen. Obviously, we don't want to live in lockdown forever. So what we're doing with our interdisciplinary team is we're trying to work with businesses, lots of different businesses, architect offices, law firms, schools, and we are working with them, really combing through the science to figure out ways tailored to their organization that they can safely reopen, risk mitigation strategies that they can employ, to try to decrease the chances that any of their employees are going to get sick. The other thing, just one last thing that we're doing, which is pretty cool, we're actually partnering with one of the largest FQHCs, federally qualified healthcare systems in the country. We designed and are actually executing the rollout of an antibody research study. So doing what we call a sero survey among all of their employees. And so that's going to give us a sense of the footprint of COVID at their organization. And that's really important because antibody, I don't know if you're familiar with the two different types of tests. There's the PCR for active infection, and then the antibody or serology test. And a lot of people are running out and getting the antibody test. And really, for an individual person, it's dangerous to interpret the results, because if you test positive for antibodies, we want to make sure that people don't have a false sense of security, thinking, oh, I got sick, I'm not going to get sick again. Or we really can't do that at the individual level. But you can do that at the population level. So we're working with organizations to do that as well.
Okay.
I hope that makes sense.
Yeah. So as that engagement of helping, teams and employers decide, when to allow people to come back, what does that engagement look like? So like I'm thinking of all the things I would think of, which is like, we're in a high rise, you have multiple people touching buttons in an elevator, going through the doors, there are shared spaces, shared kitchen. So what would like an engagement with you look like?
Well, first of all, to kick off, we really need to understand your organization and your space, right? So it kicks off with a virtual tour. Wish we could come to you in person, but obviously that's why we're doing all this. We can't now. Virtual tour, really meeting with folks who are at your organization to better understand the inner workings. Are you huddled in small groups? Do you work individually? Really get a lay of the land. And we approach it from multiple different levels. It's the physical space you're in, as you said, close contact between people, whether or not folks should be wearing personal protective equipment or masks in the building, down to ventilation, air filtration systems. It's all kinds of things. And as I said, we have this amazing interdisciplinary team. So you have immunologists, microbiologists, public health experts, physicians. We have an architect on our team, people who understand, physical spaces, airflow, engineers, all kinds of people to really comprehensively understand ways to mitigate risk.
Nice. Wow. And are there things that we can do? Because like what I wouldn't know about at all would be our ventilation system. But are there ways we as employers can help to mitigate that risk as well? What kind of practices can we take just if it's day to day to kind of prevent the spread?
Yeah, I mean, it's tough. So I guess maybe it seems obvious, but when you're, indoors in a room in close quarters with people, even if you're wearing masks, if you're in an enclosed space for a prolonged period of time, that's not great. So, you have to think about ways to increase airflow, opening up windows, opening up doors. We have to get creative now and think about things that we never thought about before. So I'd say those are some easy things. Certainly, things like hand sanitizer, not sharing, even, things like pens. You don't think about it. But I had to recently go to a doctor's office, and they did something so simple that I thought was smart. They had, a thing of pens, and then you put your used pen so that no one was reusing a pen. little things like that, right now we have to be thinking like that.
Yeah.
So.
Yeah. Well, and that's such a great point, because I'm curious how you see this impacting healthcare specifically, but just our world, if you will, into the future, right? Because I feel like we're all having these conversations of, we're calling it the new normal. And I think for a while, right, for the foreseeable future, we're going to have shifts of who comes in the workplace, or social distancing, or most people are working from home, right? Like a lot of big name businesses have gotten rid of their space, and they're just saying, nope, this is it. We're going to make, all employees are going to go virtual. And then I think a lot of people expect that eventually we will be back, because, you're taking into the account the fact that we are human beings, and we're made to be around others. So I feel like at some point, right, where, even if it's a shared space, we're like in 2021 and it's, October, and we're all like, no, we must be around more people. How do you see this kind of shape shifting the future?
Oh, that is the question. I have so many different answers to that. It's so hard to know what's going to happen, how long this is going to play out. And to be perfectly frank, I'm disappointed in our response as a country to COVID. I don't think we managed it well. If you were to ask me, right now, what would I do to get it under control? And I guess I'm going a little off topic here. I would say we need a really strong, unified federal response. We all need to do this, it's going to be crappy for a little while, but if we all lock down for a short period of time, then, it'll shorten the duration of lockdown and we can return to normalcy. The other big thing is testing, not to get too into the weeds, but we've got to get our testing in order in this country. Health testing sites are running out of the reagent that you need to actually run the PCR tests. You have turnaround time over a week. So people are waiting for their test results and going out and exposing people and getting exposed. And this is going to prolong this. So I'm like you, I want this to end. But I do think no matter what happens, this is going to change the way that we approach everything. And I think that the silver lining, if there is one to this horrible pandemic, is that I'm hoping it makes us all aware of, preventative medicine and increased awareness of the importance of things like vaccines and basic hygiene. So maybe that's the silver lining to this. In other ways, I was actually just talking to my cousin who's a physician, and we were saying, wouldn't it be crazy if masks just become the new norm? I was watching a TV show and I'm watching people on an airplane and just thinking, oh my goodness, all I'm thinking is COVID. I think this is going to change us permanently. But yeah, and just to your other question, I think when you originally asked, you said, how is this going to change healthcare? Mm-hmm. I think in a lot of different ways. I'll just pick maybe two or three. One, I'd like to think telemedicine. I think we've sort of accelerated our shift to telemedicine. We were about a decade out, and now we're here now. And I don't think it's a replacement for in-person care, but I think it's an important way to get folks access to care who wouldn't normally have it. Let's say they're working 9 to 5 jobs and they can't take off to go to the physician. Maybe this is a way to help that. Mm-hmm. It's also going to force us to rethink the structure of our health insurance system. Right now, the majority of people are insured through their employers. But if a lot of people are unemployed, maybe there are other ways that we have to think about getting people access to healthcare. And then, as I said, I really think I'm hoping this shifts the way that we think about preventative medicine. We need to really build out our public health infrastructure. And so if that's the silver lining, getting people to understand basic hygiene, maybe we'll prevent COVID, but also all the other things, the flu and all the other, viruses and diseases that float around. So
Right. Yeah. Yeah. I just was thinking, even as you were going through that there are, a lot of us know our bodies. Like, I know when a cold is coming on. I don't need to go to the doctor for that. Do I need him to write the prescription? Yes, but I just know, like, hey, these are the symptoms, and this is what I think I have, right? And then of course they would tell me if there's something like major off the radar, but it doesn't require necessarily taking that full day from work, putting yourself down on the appointment book.
Right.
Yeah, I mean, there are small things that I think that this has impacted, and then there's the big things.
Yeah. And even, I mean, think about not only the time off of work, but some people, transportation is an issue.
Yep.
If you have to take a bus and 2 trains to your doctor's office, if you're able to hop on a call or a video with a provider, how wonderful. Then, of course, there's the other issue of not everyone has access to computers or smartphones. It's not smartphones. Is it smart? What is the iPhones?
Yes. It is, yeah, smartphones. Yeah.
Okay.
I second guessed it, but yeah, smartphones.
Right. So there are a lot of issues that need to be worked through, but I think it's a step in the right direction of increasing access to care.
Awesome. So before I let you go, I want you to put out your LinkedIn and tell us where we can find your podcast and get connected with you. Because I know we were talking about the summit a little bit, and you're sharing clips. Because part of the reason we were kind of talking about pieces of that summit being available, some of the information again is still valid, and then some of it, because we're changing so often, it's like it was really great information then, but now we know all these other things that have developed. So how can people connect with you?
Yeah, so the best place to follow us is on LinkedIn and on Facebook, Vital Statistics Consulting. We're constantly pushing out lots of really great articles, studies. We're also, as I said, we have a newsletter called The Weekly Dose. We do not spam you. You get one email once a week that really breaks down the science, even in a way that's understandable, even if you don't have a background in science. Nice. You can sign up on our website, vitalstatisticsconsulting.com. And we will be launching a podcast later this summer. So if you follow us on social media, obviously we'll be letting you know all about that and how to follow us. So LinkedIn and Facebook, Vital Statistics Consulting.
Nice. I love it. Well, thank you so much for joining me this morning. I appreciate your time and knowledge and talking with us even through the COVID burnout.
Thank you so much, Whitney. Stay safe, stay sane.
Awesome. You too. Okay. All right. Thank you everyone for joining us. Until next time. We'll see you then.